morning to all the parents in front of the Facebook Live. Welcome to our Leaderland Facebook Live. Before anything, I must wish everyone Happy Chinese New Year! 恭喜发财! Okay, so today we are very, very proud to be able to invite the doctor. His name is Dr. Eng Guan from Lam Wah Ee Hospital. Dr. Tan actually is my children's doctor, and I know him for 6 to 7 years already, and he has been a very, very patient and a very, very good doctor all this while to support my children. And today we are very, very pleased to have Dr. Dan here to tell us more about the vaccine for 5 to 11 years old child. Okay, and let's see who is on the line. Do we have our parents online already? Let me see who is here. Okay, and let's see who. Okay, we have, if you are here, can you say hello to us? Hello, Coach Lin. Hello, Chunpo. Thank you very much for coming. Hello, Vicky. Hello, Ziti, Mami. Hello, Sherry Liu. Hello, Susan. Hi. Hello, Coach Alfred. Thank you very much for coming. And wow, we have 51 people here already. Okay, without further ado, and we will love to invite the Dr. Eng Guan to come to the show and to answer us some questions about vaccine for 5 to 11 years old child. Yes, can we put our hands together and give a big round of applause to Dr. Eng Guan from Lam Wah Ee Hospital.
Hi everyone.
Yes.
Hi Sophie. Hi Leaderland kids. Like to thank the Leaderland group for again giving us a platform to share with you together today.
Hi.
Hi. For again giving us everyone to share with you together today. Is there a lag? Is it lagging? Is it?
Hi, Doctor.
Okay. Yeah. So sorry. Okay. Happy New Year to everyone, and I hope it's a bit better New Year than last year. I'd like to thank Leaderland and also Coach Sophie for inviting me to share this platform regarding the vaccines for the 5 to 11 years old. As all the parents are actually very aware that we are having the Ministry of Health has already started rolling out the vaccines for the children 5 to 11, and a lot of the parents have actually been calling me because they have received letters from their schools and they ask them to fill in the forms. So they're very worried, and they're in this juncture where they are a bit worried whether or not to actually register their children. Is because of the fact that they do not know much of about the facts of safety and also the efficacy, and also whether the injections are safe for their children, especially such small children, 5 to 11. So even the adults are always having problems and always worried about themselves. Especially, I still feel that parents also will be extremely worried, especially coming to their own children at this such a small age group. So today I hope to share with you a little bit so that you can have a little bit of more informed consent, so that you can consent with more information at hand, and hopefully lead you to a very successful vaccination for your children at 5 to 11 years old. Right.
Thank you, Dr. Tan. So the first question, in the history shows, right, children aged above 2 years old, when they are affected with COVID, they will not go very, very ill. But can you share with us why our child still need to take the vaccine?
Right. Actually, it's very true that it's a real true fact that in the world data that there is not many children who actually suffer very ill consequence of this COVID disease. So many of the parents will actually ask, why should we actually vaccine our children if the vaccines the infections are not so bad and they don't feel ill so much. But you have to understand that it's actually as the disease progresses and more children get infected, especially with the new Omicron variant, where the virulence is higher, the transmission is higher, we actually will see more and more children getting sick. So in the US, in this about this time, we actually noted that about 1.8 million actually been infected, with about 8,000 actually hospitalized, and actually there are deaths among these children. So the things that we do not actually see is actually the sickness itself. There are two major sickness that the children can actually, even though it's a very small percentage, maybe about 1 to 2% of the children actually fall very ill. They can actually present with multi-system inflammatory syndrome in children. It's what we call a MSIC. So this is children who actually who are very unfortunately may get inflammation of their blood vessels, of the brain, the lung, the heart. And these children actually need ICU care, and a lot of the children can actually die from it. Now, there's also another reason why we give is because of long COVID. This long COVID can actually occur in any children who are those having very mild, maybe asymptomatic. They are very well, even though they get infection, maybe 2 3 months down the line, they have this long COVID. Long COVID, they're very tired. They cannot concentrate. They have brain fogging. Brain fogging means they cannot study. They cannot think. They are very tired. They cannot run around. They have difficulty in breathing. So what we are very worried is actually not the normal kids who have asymptomatic, but those kids may go into MSIC or also long COVID. Now, the other reasons that why we need to inject is the indirect effect, because a lot of us are staying with grandparents, parents, so intergeneration transmission. So in the household itself, we can transmit to our grandfather or grandmother, or also those children with 5 to 11 may have younger siblings who are maybe 2 to 3 who cannot get this vaccine. So if we get vaccinated, we can protect not only our grandfather, grandmother, parents, and also our younger siblings. So this is the reason why. And also why that we need to inject is because we need to move from pandemic state to endemic state. Because endemic means we're going to live with this for a long time. And we need to make sure that our children are protected. So if you have injected them, they don't get infected, they don't get transmission. In fact, they are saying that if you inject, the transmission of this infection can be reduced to almost 30 to 50%. Why not? Right? So if you are not infected, you can go to school, you can have sports, you can join your friends, and ultimately lead a normal kid's life. So the mental health of the child also will be better. So these are the few reasons why we need to inject, even though some say it's very, children don't fall ill.
I see. Thank you, Dr. Tan, on that. And then, Dr. Tan, how do I know whether my child is suitable for taking vaccine?
Right. I mean, the thing is that why they came up with this. Actually, these vaccines have been studied worldwide, and they find that these vaccines are suitable for children. As they go down, we see from old people to adult to adolescent, now 5 to 11. So any of these children who are actually everyone is suitable to take this vaccine. So of course, people ask me if allergies, for food allergies like peanut allergy, egg allergies, whether the dust allergy, whether my child can have. That is not a problem unless he's allergic to the first dose of the vaccine. Just say if he gets the vaccine and he gets severe allergy, face swelling, difficult to breathe, this is the first dose, then you may not consider the second dose. Now, children who are like autistic, or those children who are hyperactive, children with Down syndrome, Noonan syndrome, asthma, skin allergies, these are children also can have. Doesn't mean that they will be allergic to the vaccine. Those especially, they are very worried. People are calling me regarding those who have heart conditions, brain abnormalities, kidney condition. In fact, these children are prone. In fact, they do worse than our normal children because they have this comorbidity, which will cause the child to become more ill than normal children. So these children should go for the vaccine. Now, unless there are certain conditions where the children are they're taking certain drugs that can actually cause reduction in the immune system, or such as cancer patients and those patients who have got heart problems, who immediately has severe heart problems. These are children you need to consult your pediatricians. You need to consult the doctors specifically for them. But other than the other groups, everyone is suitable. Everyone should be able to tolerate the vaccine.
Okay, understand that. So means that as long as our children, as long as we are taking any drugs that will reduce our immune system, then we need to get consultation from the doctor. Okay,
Yeah.
understand that. Okay, thank you. So, doctor, another question: if my child infected with COVID, right, can the child still take vaccine?
Right. The thing is that people say that if we get COVID, and of course, do you have antibodies against COVID? Yes, of course we do. That is when our body will form antibodies against this COVID. But this infection, after infection, we get the antibodies. The antibodies will only last 3 months. It doesn't go beyond that. And how high is the antibody they have actually tested is only perhaps equivalent to one dose of your vaccine. Means you get infection, you get the antibodies. The antibodies what we call the antibody neutralizing antibodies. COVID neutralizing antibodies will only rise up as high as one dose. But if you get two doses of the vaccine, when you get it, the chances of getting COVID again is much less, about 5 times less than those who don't go for the vaccine. So if you have got the vaccine, I've got the infection, you still need to get the vaccine, irrespectively. So some countries, initially WHO says you must wait 6 months. Then they come out that you may have to only wait for 3 months, because once the antibody goes down, then you have the jab. You can start getting the jab. Now in Australia, some also suggested that you don't have to wait. You can, once you're better, you feel you're better, you can immediately get it, even after a month or even after a week or 2 weeks. So there's no hard and fast rule here. So what I'm suggesting is that even though people say, if I already got it, should I get the vaccine? The answer is yes. Reason being, the vaccine the antibody that is conferred by injection is higher than what is conferred by getting the infection itself. So the vaccine will always help giving you a better antibody level.
So just now I heard from Dr. Tan mention that if you take the vaccine, the risk of getting infection will be 5 times lower than if you do not get vaccinated.
Yes. That means for those who have already got the infection, they can still get reinfected. So if they don't go for the infection, they are at risk 5 times higher risk than those who already got the vaccine. So don't think it's safe, or if I already got it, I got already means I won't get it again. You can still get it.
I see.
So vaccines prevent that. Yeah.
Okay. Basically, vaccine is still the must for all the 5 to 11 years old child. Okay.
Yeah.
Understand. So, doctor, can the COVID vaccine inject with other vaccine together?
Now, the thing is that we are very fortunate, because 5 to 11, usually there's not much vaccines available for injections really. So remember that almost all the vaccines are completed by the age of 4. So subsequently, the next injection will be at age of 7, right? When you go to primary school.
Yes.
So the thing is that the only vaccine that we are giving at 4 to 11 would be the flu vaccine. So these actually vaccines can be given, flu vaccines and COVID vaccines can be given on the same day. It's okay. Or if you're a bit worried, you can wait for 2 weeks to 1 month. So if you get one jab of COVID, if you feel that you cannot tolerate another jab of other vaccines, you can still wait about 2 weeks to 1 month. that is not a problem. This will not change. If you get the two vaccines together, they will not change the way your body responds to the vaccine. It means the immune system can still mount the same effect if you give one or two vaccines. It's not an issue.
Okay, understand. So it is safe, okay, to have both vaccine goes together on the same day. Okay, then doctor, what vaccine should we choose for our child? Do we have a choice?
Actually, in the rollout during the Ministry of Health, actually we are actually having a lot of data from the US. We are actually the US is actually have started the vaccine in December itself. So almost 8 point something million have received the vaccines, children between 5 to 11. And these children is amounts to about 29% of their 5 to 11% population. So far they have got no side effects. And so far, there is a lot of countries actually have followed the US using Pfizer. So Canada was the second one, followed by Israel, followed by the European countries like France, and then of course Australia has started. Singapore has started 1 month earlier than us, and everyone is so far using. Those developed countries are using Pfizer. But on the other hand, some countries like Indonesia, Vietnam have resorted to use Sinovac, which is the China-made vaccine, the Sinovac vaccine. But they have started at 3 to 11. But as far as you're concerned in Malaysia, we are now still using Pfizer as the only alternative. All said and done, still Malaysia have done a few studies involving about 600 to about 800 children using Sinovac as their vaccine of choice. Between 3 to 11 is done by the Ministry of Health and is sponsored by Sinovac. But so far, no real data has come out from that yet. So I think the Sinovac vaccine is still pending. But for now, Pfizer vaccine is still the only vaccine that's available. And maybe people are asking whether we should wait for other better vaccines because other vaccines that we can help in Omicron and all that. For me, I think at this point of time, when you see the jump today, it's already how many thousand, 19,000. I didn't see today now. It's very depressing to see. So today, I don't know how many it is. Yesterday was 19,000. Today, I'm not sure. But the climb was 3,000 to 7,7 to 5 to 7,7 to 10. Now it's 13, 19. So why wait? Why wait? Why wait for some vaccine that may not come yet, or some vaccine we may not promise you a better thing when you have a vaccine which works now? Why don't you do it now? So I think it's good to don't wait and just get whatever vaccines available first.
Yes, thank you, doctor, for your advice. And what we need to be aware of after the injection, doctor?
There are certain side effects that we of course, every time people ask me about side effects, people are very worried about side effects. Now, the usual side effects for children are usually pain in the injection site, redness. Some say itching, some say swelling. In fact, some chills, some fever. These are things that is natural. You can, in fact, get it for any injections, not only for COVID vaccine injections. So these are things that can go away in 2 or 3 days. These are things that you should be able to handle. The body should be able to handle. So far as we can see, a lot of parents say, "Oh, wow, when I get the injection, second dose, teruk, cannot sleep, cannot." I also felt that way. But as a parent, I always say, "Oh, if I have such pain, what about my child who is even smaller? Would they get more pain?" But I have to understand that the children tolerate this vaccine better than adults. Second, the dose that we use for the children is very much less. So the side effects will be equivalent to the less dose. So it will not be as painful, as high fever as we adults feel. So this is one thing we can be sure of. The other things that we have to look out for is, of course, the side effects is the one that everyone talks about, which is myocarditis or pericarditis. Myocarditis is just basically the swelling of the heart, and the covering along the heart is called pericarditis. This occurs very, very rarely in the population. So these actually throughout the studies in these children, in Pfizer group 5 to 11, so far they have no complaints or no problems with myocarditis so far. This is only seen in children who are 16, 17 to 25. This group is high risk of myocarditis. So far, these groups of especially boys in this group they do get, but they are very mild. They need to admit to hospital with a bit of chest pain, a bit of fast heartbeat, But ultimately they just stay 1 or 2 days. They get some pain medicine and then they go home. No one dies from myocarditis. So people die from COVID. COVID also can cause myocarditis. Myocarditis means COVID can cause the heart to swell up, the heart to be inflamed, COVID causes more chances of myocarditis compared to vaccine causing myocarditis. So don't use that as a worrying point. Okay, myocarditis is not a worrying point. It's self-limiting. Sophie, I can't hear you.
Yeah, doctor. Yeah.
Sorry.
Okay.
Yeah.
It's okay. That the fever, right, is normally the most frequent side effects from the vaccine, right? Or maybe you can advise us, if our child get a very, very high fever, what is your advice on that? What should we do?
Okay, this usually the common side effects is actually basically like I said, fever, right? Fever
Yeah.
maybe fever is maybe 3 out of 10 people get the fever. Of course, fever is actually very simple. We a lot of my parents, in fact, some of them say, "Oh, why not?" Especially kiasu parents, they will always take some medicine and go to the hospital, take the fever medicine and go for injection. So this will prevent the pain and prevent. So kiasu parents will do that, but you don't do that because it is the actual fact is any vaccine. It's not only COVID vaccine. Any vaccine, do not take any fever medicine or any like paracetamol or ibuprofen before you go for any injections. The reason is because if you do give that, it might, in theory, may reduce your body's ability to fight to form antibodies after the vaccine injections. What is better is that if you have pain, what you can do if you have fever, you can take the ibuprofen or paracetamol immediately when you have fever, and that will reduce and make your child more comfortable. As for the site of injection, I always tell the parents, bring a little bit of ice, right? Now we've got a lot of flasks and all that. Put a bit of ice, take the ice immediately, and then put over the hand. So a lot of my patients like to use Mopico. I don't know. This is because it's cooling. Oh, it makes sense also. In actual fact, it cools down the area and reduce the itchiness. I think that also will work. I've got no problems there. But ice works very well. Paracetamol or ibuprofen.
Okay, thank you very much, doctor. Do you think after the injection, can our child still go for some heavy exercise like running around, or will that be a concern?
In actual fact, that one kid, 16-year-old kid in Singapore, he actually went to the gym after the thing and he developed myocarditis. So this is actually very, very wrong. You should not have any strenuous exercise. All said and done, children 5 to 11, you cannot ask them to sit down, right? You are teaching 5 to 11, 5 years old. You try telling them to sit down. I don't think it's possible. So children will be children. They will run around. They will go to work. You can have any form of running around, is not issue, but no strenuous exercise. Strenuous exercise means go for coaching, like swimming coaching, tennis coaching, and then go for tennis lessons, ballet lessons, sporting activities, PE. So I would actually advise, if you want to go to school the next day, I think you can. But you can tell the teacher, if I've done this, I would not participate in the PE or PE or physical activity. But you can take your kids to the playground, no rigorous exercise, just walk around. That is not an issue. But that I would advise now. But no strenuous exercise like cycling, jogging, tennis, things like that.
So, doctor, how long should the children stop for this kind of exercise?
Usually, the dictum is actually 2 weeks. 2 weeks will be a safe estimate to rest, because we do not want to stress our body. our body is actually stressed after the injection. We are our extra stressed, and also that we need the body to recuperate and to allow our body to make the most of the vaccine, so the antibodies can actually go out better. So 2 weeks will be a very good estimate. Yeah.
Okay, understand. We have one question from Yvonne saying that taking coconut water, will that be benefit to our child after the injection? What do you think, doctor?
Actually, for me, I think hydration is good. Any form of hydration, any fluids will be okay. In fact, I was standing there one day when the vaccines. Lam Wah Ee is a vaccine center, so one of our directors, who is a Chinese physician, he actually says that, hey, maybe we should give our people who come here, give them some Chinese herbal tea. So I think that I feel no harm in it. In fact, we have a machine, coffee machine in the vaccine centers, where people can actually buy beverages and all that, just to drink after, I think, a hot cup of coffee, it shouldn't be a problem. But coconut, well, a lot of people are going around with it, but I haven't tried it. Maybe after my 4th dose vaccine booster, I will try it. Yeah, but I haven't tried it yet. Maybe.
Okay.
Yeah.
Okay. So, doctor, just another question from Chia Hui To. If the kid have sickness prior to vaccine, will it surface out more severe sickness? For example, my son have tonsil. Whenever he infect by virus, he will get very high fever. Will it get worse after the COVID vaccine?
The idea is, just treat. Okay, it's very simple. Just treat COVID vaccine as any other vaccines, right? You will not. The doctors will always tell you. People call me today. People call me, doctor, I won't be coming today for my appointment for injection. I always ask them why, right? So this patient will say, my son is not feeling well. He's having fever. He's had sore throat. Right, these are the common things that people will tell you, that they know that when they're sick, they know how to avoid coming for injections. Reason being, of course, when you are sick, your body needs to recuperate. Your body needs to heal itself. So if any other extra stress, like a vaccine, it will not help this condition. Second thing, your body will not be able to mount the same immune response if you are well. So will it cause worsening if you are sick? Yes. So don't go for the injection. You can always defer. But if you're asking me whether prior he's been having tonsillitis all the while, will COVID trigger this to make it worse? No, definitely no.
Understand. So means that we will better wait until we are fully recovered, then only go for the injection, so that our immune system is being work in a normal way. Okay, that
Yes,
is what I understand. Okay,
yeah.
so to the next questions, doctor, about the dosage. If my child is 11 years old, right? Because we know that 12 years old dosage is different. Should we wait them to turn 12 years old, then only we go and take the vaccine? What do you think about this, Dr. Tan?
This also is a very kiasu type of question, right? Now, a lot of parents say more is better, right? More is better. Now, the vaccine that we are getting now is actually age appropriate. So it's not weight appropriate. So all the while, our immune system is built on age. So children at different age will respond differently to vaccines as adult to vaccine. So for me, should I wait till 12 years old so I can get the adult dose, so I get a better response? The answer is no, because now we have the Pfizer vaccine. Pfizer has actually organized a clinical trial involving about 2,400 participants, and out of the 2,400, they have tested the different doses. Means 10 microgram, which is what is available now for children between 5 to 11, yeah, at 2.2 ml, right, 21 days apart. So this is only 10 microgram. Now 20 microgram, a lot of people ask me, hey, why don't we give 20 microgram? 20 microgram means better response. They actually found out that these children, no matter whether they are 5 years old or 11 years old, they respond to 10 microgram and 20 microgram the same way. Means the antibodies are exactly the same level if you give 10 or 20 to 5 or 11 years old. So we don't have to be so kiasu to say, wait until he reaches 11, give a higher dose. No, higher doesn't mean better. So they've studied the children over this group. They find out that 5 to 11 respond the best to 10 microgram. So same protection. The protection rate is almost 91%. Now you definitely will ask me, what is 91%? Why 91%? They actually studied 2,400 children, 1,600. This is called the randomized trial. So randomized trial. So some children will get the vaccine, some children will not get the vaccine. In this trial, 1,600 got the vaccine, 800 didn't get the vaccine. So they studied this group of children after the second dose, over a certain period. They want to find out whether the antibodies are increasing. Second thing, whether it's effective enough to prevent the infection. So some of the children, they found out that those in the 800 children, actually many of them got COVID. Whereas the children who got the injection vaccine also got COVID, but much less in number. If I'm not mistaken, 1,600, only 7 got. Those who got the vaccine, only 7 developed thing. Whereas in the 800 group, about 30 got the 30 or 40, I can't really remember, was infected with COVID. So it shows that with this, it shows that the Pfizer vaccine actually works by protecting the children at about 90 to 91%. So it does help.
Understand about that. Okay, doctor. Okay, so now we are going for some questions from our parents. Do you mind, Dr. Tan? So, oh yeah, there is one more last questions here. Okay, let's say, doctor, my child is 8 years old. Okay, we are going for the last questions before we go to the parents' question. So, parents, if you have any questions, please write down now, and then we will attend to it, and then we will try our best to attend all the questions. If no, then you can we may attend Dr. Tan's Facebook Live next week. He got another Facebook Live in Lam Wah Ee Hospital Facebook page.
Yeah.
Okay, so the last question. Yeah, the last question.
Malay one. Yeah.
Sorry.
The Facebook Live will be in Malay.
Yeah, in Malay. Okay.
Yeah.
Okay. So, Dr. Tan, so if my child is 8 years old, let's say, but he is overweight, okay, his weight is like a 12 years old kid. So, what dosage my child should be receiving?
Right. Again, all vaccines, not only COVID vaccines, MMR vaccine, chickenpox vaccine, even hepatitis B vaccine. These vaccines have been actually age dependent and not weight dependent. So if for hepatitis B, in fact, like you've got the adult dose and the children dose, right? So the children dose, there is a certain age group. So they find that for COVID vaccines, 5 to 11, 10 micrograms is sufficient, right? And those who are even overweight, whether they are adult weight, some children are actually adult weight, my son was adult weight when they were small. So we fed him quite well. But they noted that despite the weight and the age difference between 5 and 11, they still respond very well with the 10 microgram. No, again, more is not always better. Okay, then some question people will ask, just say my son ngam lah. This year, this month get the injection, 11 years old, and next 2 weeks, 3 weeks time, he's already 12. So how should I go about it? Should I get the first dose, pediatric dose, which is 0.2, 10 microgram? The next month, next 3 weeks, should I get the adult dose? That is some controversy here. Some people say no need. You just go for the pediatric dose. Means in Singapore, they are doing that way. Means if you are 11 this time, today, and then 3 weeks later, you turn 12, you still get the pediatric dose. But in Australia, it's different. When you're 11 years old now, 3 weeks later, you turn 12, you go for the adult dose. whatever it is, that is not a problem. You still will respond very good, very well.
Okay, understand. Okay, that's all for our questions. And then now we will go towards the questions on the Facebook that all the parents have the questions. So from Shirley, what about epilepsy child? Advisable to take the vaccine?
Yeah, like we said that just now, that everyone is suitable for the vaccine. Certain children with comorbidity means children who have suffering from certain diseases, which people are actually look more on their safety features, especially for these type of children. So these are comorbidity children. We noted that children who actually do very badly with COVID infections are those who have problems. Those children who are not having any problems, who are healthy, they usually do better. They don't fall ill so sick. Whereas those children with epilepsy and all that, these children are falling into the children category with comorbidity, children with comorbidity. So these children actually benefit much more and should be given the COVID infection. The COVID vaccine, sorry. Yeah. They should
Okay,
take. Mm.
okay, that's good. Okay, another questions. Let's see. Can that I see that. Let me see. Okay, from Veron, is atopic eczema child whom just had her steroid injection advisable to take vaccine?
Okay, like that question is actually also very similar to the one which is patients with cancer, right? So the cancer, we are always giving a lot of steroids also. The children actually resort to steroids, a lot of chemotherapy. And in this situation, in Veron's children, perhaps with atopic eczema, to the extent of getting steroid injections, must be very bad atopic eczema. I haven't come across so bad as to give IV injections. So, but for us, if anything that can cause a reduce in immune system and immune response will somehow cause the vaccine not to work as well, I think we should delay it. Maybe you should speak to the doctor your doctor who gives it, maybe get his opinion. But as far as you're concerned, those on steroid and immunosuppressants, I will not encourage you to take it because they may not be able to mount the same immunogenicity or the reaction towards the vaccine. So maybe not so good. You can delay it for some time, yes.
Okay, thank you very much. And on the question of Sean, talking about G6PD, I think Dr. Tan has already answered that. Any allergies that is safe, right, doctor?
Right. No, G6PD is actually it's not allergy, Sophie. Sorry
Oh, okay.
to interrupt. Yeah, G6PD is
G6PD.
actually a child who is born genetically with the this G6P deficiency. It's an enzyme in the red blood cell that
Okay.
reduces the lifespan of the red blood cell. So my son is also having the same thing. So my son is, of course, he's in the 20s, so it's not an issue. But G6PD itself it's not a contraindication to get the jabs. I also got a phone call this morning, from a mother who has child who has thalassemia. So also about the same thalassemia, G6PD, they're all racially blood related. But I told them that it's not a problem. They can still get the jabs. Now, the idea is that I get individual calls quite often. The reason is that I do not want to individually tell them this and that. Is because my concern is that I do not want them to, I want to give them an informed information so they can make the consent themselves. Right? This is called informed consent. Whereas if I were to tell them, if they call me personally, hey doctor, my child this and that, 4 years ago I came, 4 years ago I see you and all that. First of all, I'm sorry, I can't remember. It's not fair for me to go online and tell you it's okay. But generally speaking, everyone who does not fall into the category of taking immunosuppressant or those like chemo drugs, steroids, I think they are fairly safe if they are well. They are clinically well. They are well. They are not no fever. I think it should be okay. Yeah.
Okay. Okay, doctor. Okay, another question. Looking at the current surge in COVID cases, do you think the school shall make it compulsory self-test by weekly basis? How do you think about it?
Okay, the thing is that we have somehow a bit diverted on this topic, but I think it's a good question. I no doubt. The thing is that we are again trying to move away from pandemic to endemic. So there will not be. We are hoping that there will be no more school shutdowns, loss of lessons, online studies. Children missing out on their playground time, and of course, this is what our ultimate aim of vaccine, right? This is the ultimate aim. But the thing is that since the surge is so bad, I think the government has actually not, and it's not mandatory to actually take again, I forgot to tell you that it's not mandatory. Means not all children must take the vaccine, not like adults. Adults, you don't take the vaccine, we cannot go to school, we cannot go to work. Adults who do not take the vaccine, we cannot go to shopping mall. For children, the government has not made it mandatory. Means even US, you want to get the jab is voluntary basis. So in the same sense here, voluntary testing is also voluntary. It cannot be made compulsory now because we are going into endemicity. So everyone, it actually falls on the onus of all the parents and all the caretakers. If they find that the children are not well and if the children are sick, I think it's automatically, as a parent, I would do the test myself, right? Without you asking me to do the test. I've got parents who ask me, doctor, I do the test one day, twice. I said a bit kofan. I think no need, right? But the idea is that you can do the test every day until you get better. First day, maybe you can't get the results, proper results, because the first day they usually don't work very well. 2 days, second day, third day, maybe you can get the saliva test if you do it properly. But to do a test properly, of course, you have to read the test kit properly. You must buy a proper test kit, maybe a $5 test kit and $6 test kit compared to $3 test kit. It makes a difference. Certified by KKM. You must buy the one certified by KKM. And if you do it properly, you may get a positive, but of course, you may get a negative, false negative. But if you find that there's any problems, you can always go to the hospital or the labs to do a PCR genomic study. That is very confirmed. It's confirmed. So you can go there. It's better than doing the saliva test, the lollipop test, So what I'm trying to say is that it falls on the responsibility of the parents. I think there's no forcing now. No, I think government also doesn't force much, It all falls on the parents and the caretakers.
Okay, and there is another parents actually asking for, do you recommend child with Kawasaki disease to take vaccine?
Right. Okay, that's a very good question. I'm sure that these parents have actually had a child with Kawasaki. Let me just give you an idea what's Kawasaki about. Kawasaki is basically your immune system working overtime. When you have an infection, your body not only tries to kill the infection, the body, what it does is that after a few weeks, after a few months, your body still thinks you have the infection. So he tries to react to the infection. So instead of acting on the bacteria or the virus, he attacks your own blood vessels of your heart, your eyes, your stomach, your lungs. So these children actually, this Kawasaki is very, very alike, like the multi-system inflammatory syndrome in children, the MSIC, like I told you. This is actually, MSIC is actually one of the complications of COVID. So Kawasaki children, is Kawasaki exactly like MSIC? It looks the same, sounds the same. The treatment also is the same, but it's not the same. So those with Kawasaki, is it safe to take the vaccine? I think yes. To take the vaccine, you may actually prevent the patient who had already had Kawasaki from getting MSIC. I think that is a good idea. So this is a bit technical. I think the parent who asked me would benefit, but those who listen may not benefit. But it's good question, so that at least those who actually have Kawasaki, who is not asking the question, they know what's going on. right? So just basically to Yali, I think if your child has got Kawasaki before, MSIC is almost like Kawasaki. To prevent him from getting it, you know it's really bad. To prevent him from getting it, I think you should do the vaccine. I hope it answers your question.
Okay. Okay, very good. Okay, and then there is another question. Yap Ming Kiet. There are some sharing that say the vaccine may have some long-term side effect like growth problem for the young age children. Is it true? Growth problem.
Right. Okay. The vaccine has been studied. The vaccine, a lot of people say this vaccine is very fast. It's like very fast turnout. So too fast that is it so fast that is it good? Right. Now the thing, every vaccine have to go through the very stringent clinical trials. All vaccines. COVID vaccine, why has it been coming out so fast? Is because the participation of the means we can get so many people to be tested and so many people to be vaccinated at the same time. That is the reason why we get so much data faster than any other infection. Ebola, MERS, SARS, they don't have so many people getting it. So they take time to collect data, collect people who got the infection. Then the trials are taking longer time. For COVID, why so fast is because the mRNA technology has been around for some time. It's not a new technology. Because Sophie always doesn't like mRNA. When I say mRNA, Sophie always tension. Very complex. It is very technical, right? But understand the vaccine, whether there's side effects, we need to know what is mRNA. mRNA vaccine, basically, mRNA goes into the cell. It doesn't go into the nucleus. The nucleus is the one that produces DNA, of the child. It will go into the cytoplasma. It acts with the ribosome. If you study biology, ribosome, it will translate the protein and make spike protein, right? After that, the mRNA basically dies. It's not going to hang around the body. Hello, 10 years time, mRNA is still running around. No. It goes in the cell, it binds with the ribosomes, translates the protein, makes spike protein. Your antibody acts against the spike protein dies, the mRNA also dies, right? So what I'm trying to say is that mRNA does not change your DNA. So if it doesn't change your DNA, it does not affect your growth. Again, another question is fertility. Whether my child next time can become Dato or Akong or not. It doesn't change the fertility. Yeah, a lot of people say, "Ayo, my son don't know can get son or not, can get daughter or not." So far, the pregnant woman who got the vaccine, the children are well protected. Those who wanted to get pregnant, who got married during the COVID period, also got pregnant. So it does not change the fertility, doesn't change your hormones so far. So it doesn't affect fertility. It shouldn't affect growth.
Okay, thank you very much, Dr.
I hope
Tan.
that answers. Yeah.
Okay, maybe we can go for about 5 more questions. Okay, Dr. Tan keep on drinking water already. Okay, Doctor. So,
100%.
okay, from Lin, yeah, my child had hydronephrosis problem. Is safe for vaccine? Is it safe for vaccine?
Again, since everyone is talking about the safety issues now, no one is actually asking about the efficient of the drug, the vaccine itself, because everyone is worried individually about their child. Those children who do not have any problems, no worries, right? Those who have a bit of problems, like Lynn, she's worried. Hydronephrosis basically is a swelling of your ureterus or your the kidney pipe. The kidney pipe is swelled up. If you get the injection, it will not increase the kidney pipe blockage. So if it's there, it's there. It won't be any problem if you get the vaccine. It won't make it worse. It won't make the hydronephrosis worse for this child. So that is, rest assured, shouldn't be a problem.
Okay. And next questions we have. The vaccine tested on 2,400 children. For other vaccine, usually the tests were done on how many children?
Right. You see, like many people says the vaccine is rushed, right? Rushed. They also like to use the word emergency use. It means the emergency use of the vaccine is by the FDA, by the CDC, the legislators. They've rushed through the vaccine. Yes, everyone said it's rushed through. But why is it rushed through? You must understand the rationale between the rush is because of the amount of problems that this COVID can cause, the amount of morbidity, the amount of mortality, the people who die, the people who suffer is so much that they rush through this. Now, to say that Pfizer only tested 2,500 at the point of time where they rushed through the thing for as emergency use, is it justifiable? I think it is, right? 2,400 may be a very small cohort. It's a very small group only. You say, I'm giving to 8 million people. But you have to understand that the 2,400, of course, is smaller than the test done for other vaccines. But because the vaccines also follow very tight clinical guidelines, we have got 3 steps. They have to follow the 3 steps. No matter whether it's 2,400, no matter it is 6,000, but they follow the steps. If they follow the steps and they come out with a protective level rate of 91%, I think it's justifiable to use the vaccine. But the thing is that what I'm trying to say is that the vaccine is rushed, not because it's rushed, but it went through very stringent testing before they are able to actually use it. And rest assured, we are in the lower southern hemisphere. Those people with you can say our Asian countries are actually benefiting a lot, because those people who are the Pai Lao Su is the Mat Salleh, right? The Mat Salleh, the US children are the Pai Lao Su. We are actually benefiting already. We have already waited 3 or 4 months to see whether they are the Mat Salleh turn into monkey, after getting the COVID injection. They didn't turn to monkey. They are still human, right? So the idea, this is just a joke. What I'm trying to say is that we are already benefiting. They have given the benefit of doubt. The children in the US, the 8.9 million who have already gotten it, no one has gotten the very bad side effects. So we as nations, we are already benefiting from that studies. So I think rest assured, don't harp on the 2,400. We should see about 8 million people who have already been injected and in fact already received the vaccine. No side effects so far.
Yep, that's very good, Doctor. And we go for 3 more questions, okay? From Bear, if my kid is just taking influenza vaccine, how long should wait to take the COVID-19 vaccine and vice versa?
Okay, now why we are so worried about flu? Flu is a seasonal flu. No? In Malaysia, there's no season. Every day is the same, right? Raining, hot. Now, influenza in the States, in temperate countries are different. They have got two types of influenza vaccine, one for the northern strain, one for the southern strain, for 2 different seasons. So they noted that COVID always gets worse during the winter season, the autumn season, when things are cold. So the same goes as for flu. So flu and COVID are like heng tai like that, like heng tai like that, like brothers like that. So they always go together. Now, why flu has not been people getting flu is because we have been cleaning ourselves, we've been very sterilizing, we are closing our mouth. That's why flu now is not as bad as before. Before COVID, I can get 10 people admitted one day. Is that bad? So what I'm trying to say is that flu should be given together with COVID vaccine. It can be given at the same time, or if you're really worried, you can give it after 2 weeks or 1 month if you're really, really conservative, or you can give it before or after the COVID injections. In fact, some have also trying to decide whether to give COVID and some companies are maybe like in the future they will be thinking of giving COVID and flu in one jab. It's possible because now we are in certain countries they're getting flurona. Have you heard of flurona? Flurona is basically flu and corona. I told you they are marriage that flurona. The name of flurona.
Yeah.
So the idea, so go ahead. You can get the influenza injection on the same day as COVID. There's no issues. In fact, your antibody levels are able to rise accordingly, no problem if you get 2 together. Or if you're really conservative, 2 weeks. Really conservative, 1 month. I hope that answers your question, Elizabeth. Yeah.
Yeah, that's very good. So we have two more questions. Will kids need to take multiple doses later on, like adults?
Now, in actual fact, in the States, what was recommended as a booster dose is actually recommended for 65 and above. And once they finish with the 65 and above, they noted that why don't we go to the lower 40 and above, and subsequently going down and down. But so far there is no indication to give those from. So far there's no those who have received, adolescents who have received from the age of 12 to 18. They have not given the booster dose yet. They are not going to be giving the booster dose yet, because for the moment they find that the neutralizing antibody is still high. But you have to understand the concept of giving booster. Why? You know that the antibodies in our body will not last for long. You just imagine like Sophie teaches children standard 5, right? Maybe it's 5 years old. Tomorrow they come back, ask you the same question. Will they remember exactly what you teach them? Probably not, right? Unless, Sophie is a good teacher, no doubt. But what I'm trying to say, your body will recognize after the injection, you'll give good antibodies. But after a while, the antibody will wane. Wane means it will go down. So a booster dose will teach you again the antibodies to bring up more higher antibodies, make more higher antibodies. But the idea is whether the children is going to get multiple doses like adults, I do not know. But there's no real life data yet, no real world data. But the idea is that I think they may. But so far as we are concerned, for what we are concerned now, the 16 to 18, there's no boosters available yet, or not indicated yet. The idea is why is because of the Omicron variant, the variant of concern. What we call a variant concern. What started out from Wuhan is not the same as the variant now. What started from Wuhan went to US. It became Alpha to Delta, Delta to Omicron. Next time maybe different other names. These, they are already mutating. So for those patients who do not get the injection, they can mutate in that particular person. And people ask me, if I get this injection is actually not made for Omicron. This vaccine is actually made for Delta, maybe Alpha, maybe Wuhan. Why? How is it going to help me if I get Omicron? So the idea is that it's not meant for Omicron, but it will still give you enough protection to prevent you from going to the hospital. Doesn't mean that because it's Omicron, the antibody, the vaccine doesn't work. It's not true. If you get the vaccine, your body somehow has enough antibodies to help you prevent a serious infection. So multiple doses for now for children, not in the books yet. Yeah.
Then so we go for the last question. Doctor, what is your opinion about the pericarditis side effect after COVID vaccination?
Okay. Yeah, again, like we said, pericarditis is of course the main worry. Pericarditis means the swelling of the covering of the heart. Myocarditis is the swelling of the heart. So, like I said, in children, some people estimate for adolescents, 16 to 25. If your child is 16 to 25, my son was 16 to 25. Of course, my son, two of them is 16 to 25. 25 years old. One is 22. One is 20. One is 18. Of course, I'll be more worried. Like I told you, these group of children, especially boys, are more prone for this. But 5 to 11 so far as the US studies, out of the 88.9 million, 10 million, maybe 10 million by now, I'm not sure, because that is the old data we talked about maybe a month ago. They have not found any incidence of myocarditis or pericarditis in these 5 to 11-year-old children. You'll be very worried if I say pericarditis doesn't occur. I'll be bluffing. I'll be telling you lies. If it doesn't occur in children 16 to 25, it does. Some say 7 out of 100,000 population. But again, they find that even I had some patients who had a little bit of problems with the heart, but they self-recover. It's self-limiting. They don't die of myocarditis. They don't die of pericarditis, but they due to the vaccine. But they can die of myocarditis, pericarditis because of COVID infection. If you think of it that way, the risk outweighs the good. I mean, the risk outweighs this problem there.
Yep. So understand, Dr. Tan. So your opinion is the safest is to take the vaccine. Okay, in between 5 to 11 years old, for those child who do not have any problem, for sure we will need to go for the vaccine so that we can prevent the numbers going up, and then hopefully we don't expect things to go back to previously, but at least we can have a safer mind to let our children continue learning, like what Dr. Tan said earlier. Yeah. And thank you very much. And I think this is the end of our sessions. And we thank you very much, Dr. Tan, for your 60 minutes Facebook time, Facebook Live. I believe it's benefited many parents out there and have a peace of mind of saying that vaccination is safe for 5 to 11 years old. Please make the appointment and go for vaccine for your children. And then before that, we would like to give a certificate to Dr. Tan. And here we go, Doctor.
Wow. So special. Thank you.
Yes, we have you in the certificate, and I'm going to print it out and then deliver to your office. Okay, Doctor?
Okay, thank you, Sophie. Thank you, Sophie.
So, and then, yeah.
Okay,
So,
I'll just close today also. I hope that whatever we shared today is actually an opinion, not only opinion of mine. I've done a lot of studies, a lot of gone through a lot of webinars and all that. And these are general thinkings of many of the doctors. Don't over listen to people who are anti-vaxxers. Don't listen to people of one-sided story of what happened to them. You don't Google things and only see the bad things of things. What, like Sophie says, we have to move from of COVID pandemic to endemic. Say we have to live with it, for many years. Make our lives more normal. Go for the vaccine. Trust in the government. Trust in the science. Trust in the science. Don't listen to grandmother stories. Trust in the science. That's all. All the best and happy vaccination to your kids. Thank you.
Yeah, thank you very much, Doctor. And happy Chinese New Year to everyone before it ends. And thank you very much. 恭喜发财.
Thank you, bye. Happy New Year.
Stay safe,
Bye.
all the parents and children. Thank you very much.
Happy New Year. Thank you.
Bye.
Bye.